facing a lung cancer diagnosis, you're also facing a whole world of questions about treatment. So in this explainer, we're going to walk through those options together, step by step. The whole goal here is to help replace some of that uncertainty with clarity, so you can feel a little more prepared for the path ahead.
And if you're feeling scared or overwhelmed or maybe just completely stressed out, that is perfectly okay. That's normal. A diagnosis like this is a heavy thing, and it's so important to acknowledge those feelings.
But knowledge really is a powerful tool. So we're going to break down the key parts of treatment. We want to help turn that tangled, confusing feeling into the kind of clarity you need for this journey.
Okay, first things first, and this is maybe the most important thing to remember. You are not alone in this. Not at all. You're going to have a whole team of specialists dedicated to you. Think of them as your personal support crew, all working together to build the best possible treatment plan for you. And this team, it's really comprehensive. Of course, you'll have your lung specialist, the pulmonologist, and your cancer specialist, the oncologist. But just as important, you'll have people like nutritionists, physical therapists, and psychologists to support your total well-being. It's truly a full-circle approach to your care. So let's talk about the tools your team has to fight this. There are 5 main types of treatment for lung cancer, and a lot of the time, they're actually combined to get the best results. It's pretty amazing how far these have come, moving from really broad approaches to incredibly precise strategies. First up, we've got surgery. This is really the most direct approach you can take, physically going in and removing the cancer. Now, depending on how big the tumor is and where it's located, this could mean taking out just a small piece of the lung, or maybe a whole section, which is called a lobe. Next is radiation therapy. You can think of this like a super-focused, high-energy beam that's designed to kill cancer cells and shrink tumors. This can be delivered from a machine outside your body, or sometimes from tiny little implants placed right inside, very close to the cancer itself. Then there's chemotherapy. These are really powerful drugs that travel through your entire body to find and destroy any fast-growing cancer cells. Because it goes everywhere, it's often used after surgery, just to make sure we get any cells that might have been left behind. Now, things get a little more precise with targeted therapy. These are medications that are designed to attack very specific weak spots inside the cancer cells themselves. It's kind of like having a special key that only fits the lock on a cancer cell, stopping it in its tracks without doing as much damage to healthy cells. And finally, there's immunotherapy, which is really fascinating. This treatment doesn't actually attack the cancer directly. Instead, it basically supercharges your own immune system. It teaches your body's natural defenses how to better find and fight off the cancer cells, all on its own. Okay, so now that we know the toolkit, let's see how these treatments are actually used. We'll start with non-small cell lung cancer, or NSCLC for short. This is the more common type, and how it's treated really all depends on the stage of the disease. Right, so to really get the treatment roadmap, it helps to see the difference between the 2 main types. Non-small cell, the NSCLC, is more common, and you could say it's kind of like the turtle. It usually grows a bit more slowly. That's why it's staged from 1 to 4. Small cell, on the other hand, is more like the cheetah. Less common, but way more aggressive, so it gets categorized differently, which we'll get to in a minute. So for early stage NSCLC, we're talking stages 1 and 2, the main goal is often a cure. This usually kicks off with surgery to get the tumor out. After that, your team might recommend what are called helper therapies, things like chemo or radiation, which are used to lower the chances of the cancer ever coming back. Now, at stage 3, the cancer has spread a little more in the local area, so treatment gets a bit more complex. If the tumor can be completely taken out, surgery is still a great option, usually followed by chemo. But if surgery isn't on the table, the plan shifts to a powerful combination of those other therapies to fight the cancer from all sides. In stage 4, the cancer has spread to other parts of the body, so surgery usually isn't an option anymore. At this point, the goal of treatment shifts. The focus becomes prolonging life and, just as importantly, managing symptoms to keep your quality of life as high as possible. And this is where something called palliative care becomes absolutely essential. Palliative care is so often misunderstood. It's not just for the end of life. It's comfort care that you can receive at any stage of treatment. Think of it as an extra layer of support that helps with everything from physical pain and nausea to emotional stress and even financial worries. It's all about improving your quality of life. All right, let's switch gears and talk about small cell lung cancer, or SCLC. Like we said, this one's the cheetah. It's more aggressive and grows faster, so it needs a totally different game plan for both how it's classified and how it's treated.
So instead of stages 1 through 4, SCLC gets broken down into 2 main categories. You have limited stage, which means the cancer is just in one lung, and treatment there often involves chemo, maybe surgery, and radiation. Then there's extensive stage, which means it's spread further. The plan adapts here and often includes immunotherapy. And that brings us to something called ICI, or immune checkpoint inhibitor therapy. This is a really powerful type of immunotherapy. Basically, it works by taking the brakes off of your own immune system, which allows it to recognize and attack those cancer cells much more effectively.
And understanding all these treatments is just so vital. I mean, to put it into perspective, lung cancer accounts for a staggering 25% of all cancer deaths in the United States. And we don't share that statistic to scare anyone, but to really underscore why having a strong treatment plan and focusing on your own well-being is so incredibly important. Which brings us right to our next section, taking care of yourself. Medical treatments, they're one half of the equation. But empowering yourself and supporting your physical and mental health, that is the other absolutely critical half of this battle. And this doesn't have to be some huge, complicated thing. Simple, powerful steps can make a massive difference. You know, focusing on good nutrition and rest, maybe some light exercise when you feel up to it, and managing stress, even just with deep breathing or enjoying a hobby. It's all part of your treatment. And please never underestimate the power of just talking with your family, a support group, or a professional. So where do you go from here? Well, the most important thing is to just stay in close communication with your care team. They really are your partners in this. Ask all the questions you have, make sure you understand your plan, and know what resources are out there to support you. So we'll leave you with this to think about. Because being an active, engaged participant in your own care is one of the most powerful things you can do. And it all starts with that very first question. Thank you for spending this time with us, and we wish you the absolute best on your journey.